So basically, we evaluated the efficacy of external trigeminal neurostimulation, which is a novel neurostimulation device for children with ADHD. But we found no differential treatment effects between the real and the sham condition. So we evaluated the efficacy on children and adolescents from 8 up to 18 years old, following a pilot study that was conducted in the US where they found an effect and that informed the FDA approval. Unfortunately, we didn't find any differential treatment effects. And regarding safety, we found ETNS to be safe. So most of the participants reported no side effects. They did not report any serious adverse events. And the percentage of participants who reported side effects were like really minor headaches or problem falling asleep, for example. Well, on the TNS, unfortunately, on the pilot study was conducted, the one I mentioned before that informed FDA approval. So in comparison to that pilot study, we utilized, first of all, a multi-center design to improve generalizability. We recruited more participants, so 150 participants over 2 sites. We recruited also adolescents, which is a very important, clinically relevant population, while in the pilot study, they only recruited children up to 12 years old. And also we investigated long-term efficacy of TNS. So after also 6 months, we wanted to check a persistency of effects, while in the previous pilot study, they only investigated effects after 4 weeks after the treatment period. So, and also we utilized more objective measures. So we employed neuroimaging methods to check if ATNS had any effects also on the brain. In addition to ADHD symptoms, we utilized measures of objective hyperactivity by using a wristband device. We also employed pupillometry to check any effects of TNS on the arousal system. So all of this was not done in the previous pilot study. Well, we can talk about mainly TNS. TNS, unfortunately, I mean, it's safe. It's a safety intervention, but unfortunately, it's not efficacious in improving ADHD symptoms for pediatric ADHD, and should not be considered prioritized over standard first-line treatment for ADHD, which are currently stimulant medications such as amphetamines and methamphetamines. And also, clinicians should look at rigorous evidence, such as the one generated by these kinds of well-powered study, before advising patients to, let's say, employ a novel treatment, such as this type of brain stimulation devices. Well, first of all, I think that new research, like, for example, on ETNS, should continue to utilize like objective measures like neuroimaging to check any effects of TNS on the brain. And also new research should identify who may benefit most from like new brain stimulation treatments. Maybe this can be like little children, or individuals with specific types of ADHD. We have specific types of ADHD symptomatology. For example, individuals suffering from attention deficit disorders may benefit more from certain treatment compared to those who are mostly hyperactive. And also, new trials utilized maybe brain stimulation device in combinations to medication to check whether if the combined treatments are effective, or directly conduct comparative trials, so comparing brain stimulations to medication treatments. Well, yes. Well, it's related to what I said before, just emphasizing the importance of these rigorous, well-controlled trials when evaluating neo-ADHD interventions, and that clinical decision should remain grounded on strong evidence for pediatric ADHD. And unfortunately, that FDA clearance means that a new treatment may be safe, but it doesn't mean that it's effective in improving symptoms of patients.